Welcome to another episode of Kidz Chat. This is Dr. Slaughter and Dr. G.
Good morning.
And today we're going to talk about chest pain. I have a pediatric cardiologist here with me, and so I think it's a really important topic because we get it quite a bit for teenagers in primary care. So Dr. G, when someone comes to you, what's the main symptom they usually complain of?
When it comes to chest pain, there's a wide array of symptoms that people may talk about, especially, and it depends on their age. So for example, a 4-year-old might say, my heart hurts. As you get older, they become a lot more descriptive in what they're feeling. They may describe a sharpness or a pressure or a tingling in their chest or simply just a discomfort that they might feel.
Okay, awesome. So usually the primary care doctor would see the patient first and then they would refer them to you, correct? A cardiologist. So from a primary care standpoint, what is it that I need to look for when I have a person presenting to me with chest pain?
So one of the defining characteristics that one wants to look for is, was the chest pain at rest or was it with activity?
Okay.
And so usually we take the ones who have had chest pain with exercise, let's say we take it a little more seriously, but it's just raised to the alertness to look for certain things that may be a little bit more malignant.
Okay, something going on.
Right.
And is it safe to say that a younger person who comes with chest pain, we should always send them to a specialist, and an older person, no? Or
yeah, so I mean, it depends on. I always rely on the comfort of the physician or the provider to decide how acute they think the situation is. Not all patients who have chest pain necessarily require a pediatric cardiology evaluation. But for sure, it's based on the frequency, it's based on the severity, and it's based on the family history and the concern of the parents, right?
Very true. And so, I mean, I think it's safe to say that when most people, their children or child complains of chest pain, the first thing their mind goes to is my child having a heart attack.
For sure, right.
So how common is a heart attack in a child?
Right, so it's rare to happen in a child.
Right.
Having said that, it's the first thing that we think about, and it's kind of hard to ignore.
Right.
The good thing about most chest pain in children is it's not related to the heart. The things that we kind of look for are respiratory symptoms, gastrointestinal symptoms. Is it anxiety? Right?
Yes, I get a lot of that, especially in teenagers.
Right. But from a cardiologist standpoint, I never just ignore somebody's symptoms and say, oh, you're just being anxious. My number one goal is to rule out any type of heart disease that may be caused by chest pain. Whether it be something that the person was born with, as in congenital heart disease, or was it something that they acquired, such as, for example, we can actually have chest pain from a virus.
Very true.
Right? Or let's say somebody has a cold.
A cold, right? That's very true. Very true. Okay, so that's the kind of more benign symptoms. So then you do have real symptoms that we get worried about. So say I have a teenager out on the football field, they're playing football, and then boom, falls to the ground, starts complaining of chest pain.
Well, that to me is a red flag.
That's a red flag, right?
Usually in that situation, the coach or the parent who's watching would have called EMS for an evaluation, have them taken to the hospital. Any athlete that has that type of pain where they are falling to the ground and it's so severe, they would be worked up in an emergency room. You don't necessarily want to wait to go to your primary care provider and then get a referral to a cardiologist. I mean, that can take 24 to 48 hours sometimes.
Very true. So it's kind of safe to say that if this is something that's been kind of lingering, ongoing, milder symptoms, then the likelihood of it being something really serious is less.
Yeah, correct.
For the most part.
That's correct. Okay. So usually, and more often than not, when a child or adolescent presents as an outpatient to a pediatric cardiologist, the chances of it being cardiac related are
a little bit less.
Right.
Okay, well that's reassuring, I think, to know.
Right.
And then, so say I still see somebody, mom is concerned, child is concerned, I send them to you as a cardiologist. What would your initial workup be for that patient?
Right, so the initial workup is first we do a consultation. I acquire history, the patient's history, a family history, anything that recently might have happened to the child. Do you play sports? Do you lead a sedentary lifestyle? I even talk about diet. Because, let's say you have that kid who's eating a lot of spicy foods late at night. Well, they can have chest pain. And then from an evaluation standpoint, I'll do an electrocardiogram, which helps us determine the the rate and rhythm of the heart, and then we'll be looking at the sonogram or the echocardiogram to look for a structural heart disease.
Okay,
Right.
okay. And then when you do, say, the echocardiogram or the ultrasound, is there anything specific that you're looking for?
Right. So the things that we're kind of looking for, we're looking at the size of the heart, the structure, the function. We're looking at the coronary arteries. The coronary arteries are the arteries that kind of feed the heart muscle with the blood that it needs. In an adult, you're looking for obstruction or blockage.
Right.
In a child, you're looking for the origin of those arteries. Because if the origin is abnormal, then and you can potentially have compression of those arteries, and that can actually cause a heart attack in a child. And so those are the things that we're looking for. Also, we're looking for the things that might cause sudden death in young people who may have hypertrophy of the heart. Hypertrophy is the increased thickness of the walls of the heart.
Okay.
You know,
Okay.
So those are things that we're looking for from
very
a cardiac
good.
standpoint.
Very good. Awesome.
Right.
So in summary, you're saying that the majority of chest pain is actually not related to the heart.
Correct.
Usually in children.
Yeah.
It can be respiratory symptoms. It can be even anxiety, as you mentioned.
Yes. Gastrointestinal.
Gastrointestinal.
Diet, gas. I mean, you know, a lot of people go to the emergency room for chest pain, or
Right.
they think that the parents might think they have some type of infection in their stomach, and you just kind of find out it's just gas.
Very true. Very
Right?
true.
Yeah.
Which is best case scenario.
Yeah,
for
that's
a
best case
patient.
scenario, right? But having said
Very
that, you know, we
easily
always
treatable.
evaluate.
Right,
you
always
know,
evaluate.
just to be thorough.
Right. And so
Right.
then if we do send them to a pediatric cardiologist, they would either do an EKG or an echo just to ensure that there's no functional issues with the heart.
Functional or structural.
Or structural
Right,
issues
correct.
with the
Yeah.
heart. Okay.
So, and you know, and I always tell parents, even though everything is normal today at this present moment, there is a possibility that things could potentially change. Now, having
Right.
said that, those are rare scenarios. That's why we try to get as thorough a family history as possible.
Yes, family history is very important.
To determine risk. And the one thing I always tell parents and children is do not ignore your symptoms, okay? If you feel uncomfortable, you don't necessarily need to see your doctor or a cardiologist, but to kind of make note of it. And if it's something that's getting worse or increasing in frequency,
Right.
please alert your parents. Because sometimes you have children, they just love sports so much they fear
They don't
that
want to,
they're
yes, they don't
They
want to
feel the
tell
parents-
anyone
exactly,
because
feel
they
the
want to keep
parents-
playing.
Right. They feel the parents might tell them, look, you can't play anymore.
Yes, that's
and I
very
definitely
true.
understand. But the goal is to make sure you're healthy first.
Yes,
And
absolutely.
then we can take it from there.
Absolutely.
Right.
Yep, for sure. All right, well, thank you.
Yeah.
I appreciate it. So that's been very informative on chest pain. As Dr. G said, if you're a child, please alert your parent or an adult if you are experiencing these symptoms. And then after you present to your doctor, then your doctor will decide what the next best step is for you.
Exactly.
All right.
Perfect.
Awesome. If you have any questions, concerns, please let us know. If not, this has been another episode of Kidz Chat with Dr. Slaughter and Dr. G. We'll see you next time.
See ya. Thank you.
Bye.